My name is Dr. Bradshaw, and this film is intended for my RAD 2612 students. We are studying congenital anomalies, and this film is about a limbus bone. Limbus is a migration and herniation of the nuclear material through a secondary growth center of the vertebral body. What happens then is that secondary growth center never adds on to the rest of the body. You must differentiate, are you looking at a limbus or are you actually looking at an avulsion fracture? Some people say that the way that you can tell the difference is that an avulsion fracture would have jagged edges, whereas a limbus would have smooth edges. But that's not always something that you can count on. You can also sometimes make a distinction between looking at the location of where it is, whereas an avulsion fracture is more commonly found on the inferior anterior aspect of the vertebral body. A limbus bone is more commonly found on the superior anterior aspect of the vertebral body. Clinically, you should be able to tell the difference by presentation and case history of the patient. Of course, if there's trauma and a fracture, there's going to be swelling, pain, localized, and probably redness. Whereas if you have a limbus bone, been there all their life, they may not even be aware that they have one. Looking at the schematic, it looks something like this. And so again, that piece never adds on to the rest of the vertebral body. Looking at a film, it looks like this. Superior anterior location is a key on this film. I don't really think that the edges are as smooth as I would want it to be, but this is a limbus. And I also have a limbus that is from an old film, and you notice that the edges are much more smooth on this, and so this one is also a limbus. This concludes the tape on limbus bone.